Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Tim Blenko, the Chief Operating Officer at YMCA of Western North Carolina. Welcome to our program today, Tim.
Thank you, Angela.
Before coming into this current capacity, Tim served as the former Executive Director of YMCA of Western North Carolina. He's been the Chief Operations Officer of North Central Florida YMCA. He studied Human Services at Springfield College and comes with a host of volunteer experience. He is the former Chair on the Board of Directors of Mission Hospital McDowell, former Chairman of the Board of Directors of the Good Samaritan Clinic, also part of the Board of Directors of McDowell Health Coalition, and a new assignment. He's on the board of directors for the Friends of Fonta Flora State Trail. And we are so excited that he is here today to talk to us about YMCA of Western North Carolina. Tim, why don't you start by telling our viewers a little bit about your organization?
Well, absolutely, thank you. The Y of Western North Carolina was founded about 131 years ago. So we've been an anchor entity in Western North Carolina for a long time. At present day, we have 8 membership locations in 3 counties. So that covers Buncombe, McDowell, and Henderson counties. We do a host of community outreach, whether it be after-school childcare programs. The YMCA of Western North Carolina is the largest provider of licensed childcare in the state of North Carolina. So we typically take care of about 1,200 kids a day. We've got a plethora of middle school programs. We call them the Horizons programs, and that's functioning at every middle school in Buncombe and McDowell County. And then we do a lot of community health work. We're really focused on improving the health of our community. So whether that be through diabetes prevention management programs, our mobile markets, child nutrition programs, we always like to say that a good Y is there to meet the needs of its community. So we've really been building our capacity. And then in 2020, as COVID's happened, we've really been able to kind of hunker down and expand that. Another exciting thing that's probably near and dear to the folks at Pisgah Health Foundation is 5 years ago, we opened up YMCA Camp Wataya, and that's just outside of Bryson City. It's an overnight camp that we opened up, knowing that we have so many overnight camps in Western North Carolina, but a lot of our local youth never get to participate in them. So 2020 would have been our 5th summer out there, and it is a wonderful, wonderful amenity that we've been able to bring to our community the past couple of years.
And I know we're all looking forward to the return of that, hopefully sometime,
Absolutely.
maybe in 2021.
I'm counting the days. Yes.
Oh, aren't we all? So the longevity of the organization, as well as just the breadth of what you're doing. Most of us probably didn't realize the largest provider of licensed childcare in Western North Carolina. That's incredible, the service that you're providing to meet those needs along the way. And how does the grant that you receive from Pisgah Health Foundation specifically help you serve Western North Carolina?
Well, honestly, when we wrote this grant, we didn't realize how critical it would be. I think we've all in our own ways experienced 2020 differently. But what we've seen at the Y is from March to May, from the middle of March when the pandemic really set in through the end of May. We did the equivalent of mobile produce distributions in that 3 to 4 month time frame that we did in all of the prior year. So we were really just set back by the amount of need, and it continues today. So really, when we approached Pisgah Health Foundation, it was, hey, we built this great work. Will you help us sustain it? Whether that be our mobile markets and the produce distributions or cooking matters, and what we like to say, kind of jokingly, is we just don't hand a family an eggplant. We like to make sure that they understand, how to cook it, that their kids get to partake, cutting it up and, helping prepare the meal, because we know they're going to be far more likely to eat it. So some of those things we've been able to kind of find a hybrid way. So we're able to do cooking matters to a certain extent in person for families that are able to go physically be present at one of our markets. But we're also doing a lot of the virtual cooking instruction online. So we're able to serve a lot more families that way. So really what we thought was just a means to sustainability when we approached Pisgah Health Foundation, it's now been really essential to helping us meet the needs that are just compounding every single day in Western North Carolina. I think the other thing that we've noticed firsthand is we tended to have a pretty even mix of children in our child care programs. You know, when I mentioned the 1,200 kids on average a day, we've really seen that shift to the lower end of the economic spectrum. And now it's about 75 to 78% of the families that we're serving on a daily basis are on state subsidies. So they're the, you know, extreme low income families. So just to kind of put that in perspective, you know, a family of four, you know, making about $24,000 a year is where that qualifying line is. So, you know, a lot of these families are really, you know, just literally living paycheck to paycheck. So what we're able to do is really connect some of those families to our markets and to some of the other social support structures that we have in place, whether they're provided by the Y or another community-based organization. I also think looking to the future, and you know, we spend a lot of time with staff and volunteers on this. You know, really, as I said, a Y is there to meet the needs of its community, and right now those needs are evolving more rapidly than they have before. When we look at the impact of you know, a traditional summer and the summer learning loss, we like to say now that, you know, we've got a lot of first graders that are in school, but they missed half of, you know, kindergarten, so they're not your traditional first grader academically. And then the social emotional structures that have been lost, you know, because of, you know, trauma to the family, or they're no longer doing in-person education. So, you know, I think moving forward, when we look at, you know, the Y's got our triangle, it represents spirit, mind, and body. And I think, you know, the impact, you know, on that spirit, mind, and body collectively throughout our community, I don't even think we've begun to scratch the surface. So organizations like Pisgah and other legacy foundations, I think, are going to play a far more critical role in our recovery as a community, you know, these next months and years than we even thought of, you know, back when y'all were established.
Tim, I think you're so right about we don't understand the impact and how far reaching this year is going to be on the lives. And I'm just grateful for what you and the organization have done to come alongside for the childcare needs, to come alongside and, as you said, not just provide the food, but help them to know how to prepare it, and really going above and beyond, but in a way that is really just hitting at the essentials as you described. You know, so many things that are out there. What else would you like our viewers to know? How can they come alongside you, support you, get involved, and be a part of YMCA of Western North Carolina?
I think there's a lot of ways, Angela, and thank you for asking that question. I was just on a listening session with our staff, and you know, the needs for and you know, personal aside, I've got 3 young kids at home, and we've been doing, you know, virtual learning since the academic year started, and it's a challenge for me and my 3 kids, where I'm the dad and I can say, hey, look, sit down. In our child care programs, and again, you know, with the population that we're serving, we have staff working with 15 kids on 15 different schedules, trying to get them online at the same time. And our demographic has gone so much lower, you know, in addition to having, you know, more subsidized families in the program. We also have far more kindergarten, first and second graders. So their ability to come in and be ready to learn, you know, at 8 o'clock in the morning just isn't there like it is with kids in 4th and 5th grade. So, you know, anybody who's willing to, you know, complete the background check process, obviously, but to you know, lend a hand either virtually as a tutor or coming into some of our childcare sites. You know, the Kellogg campus out in Henderson County is a virtual learning center 5 days a week. And we just need a lot more help, you know, nurturing these kids so we can make sure that they progress academically. And again, the social emotional needs as well are there as well. And just, you know, having a mentor, you know, with some of these kids is just so impactful. I think the other thing that is a wonderful opportunity for anybody who's willing to volunteer is we've got mobile markets 34 times at 34 different sites every single month. So, you know, being able to, you know, help us sort the produce, get it out to site, setting up the markets, serving the families, everything we do out there. We really try to offer what many folks would consider a first-class farmers market experience with no questions asked. There's no dollars exchanged, but everybody is cared with love, respect, and dignity when they cook, when they show up to a market, and we want to make sure that we're able to provide that, as best we can, right now. So that's another excellent opportunity for folks to come in and volunteer. But we're hiring, ironically, we need staff right now as well. So, really just come to our website, check that out, whether you want to get involved as a staff member, as a volunteer, or as a donor. Last year, we're preparing our annual report right now. We did about $5.8 million in subsidized services in Western North Carolina. We finished last fiscal year down about 1.3 million. That's obviously not sustainable, but we also have a hard time saying no to our community when they ask for our support. So we need organizations like Pisgah Health, we need individual donors, and we need volunteers to make sure that we can continue to help our community as best we can.
The needs are plentiful and ever growing, and the opportunities to help and serve are a wide variety of ways that people can get engaged along the way. Well, Tim, on behalf of the Board of Directors at Pisgah Health Foundation, I would like to say thank you to you and your staff and your volunteers who are working so diligently to meet such a wide variety of different needs for families in Western North Carolina. We are very, very grateful for the work that you and your team are doing. And we thank you for taking time today to join us here on Pisgah Health Today, and hope to have you back again sometime in the future to showcase it more.
Oh, anytime. It's been an honor to be with you, and thank you so much for all that you guys do as well. It means a lot to all of us.
Well, fantastic. We also want to thank Wildflower Media for their technical and creative support in bringing these programs to our viewers, as well as the Board of Directors and the staff at Pisgah Health Foundation and the Physicians Roundtable. Until we see you on the next Pisgah Health Today, stay well and be well.
Thank you.